Let me first begin with a disclaimer to let you know that I myself, in looking at this as an independent reviewer, these opinions are my own opinions based on my interpretation of the evidence, and certainly there may be others, and some of you who are reviewing this that may have a differing opinion. That's completely fine, and I would urge you to provide your commentary and your feedback if you have points of interest that could be clarified based on what I've said. So what's the issue? Or the issue as I see it? The issue as I see it is that nobody argues that viscosupplementation, and I'll use the word viscosupplementation, although some of you may argue we should be using hyaluronic acid. But for terms of consistency, I'll use that term viscosupplementation. But nobody argues, certainly nobody I've seen that argues that viscosupplementation does not have a mathematical or what we're considering a statistically significant improvement in pain across the randomized trials primarily and across the meta-analyses. The real issue that's come up of recent is whether or not this difference, this X point difference between treatment and controls is clinically important. And this gets to a complete debate, a debate that has been one that has been argued in evidence-based practice since its inception and really has become heated in the last decade or so as it relates to any sort of therapy that has a cost associated with it. Is the cost and benefit we're getting with that therapy sufficiently warranted due to its clinical important effect? And by clinical importance, we'll discuss what that means, but fundamentally it means is just because something has an X point difference, 3, 4, 5, 6 point difference on some pain scale, does that translate to a real difference for patients? And in fact, there has been lots and lots of debate in the literature that suggests that any sort of therapy like this may not be worth the risk or may not be worth the issues or the complications. So we've seen that happen in multiple editorials recently. We've seen that happen in multiple reviews.